Hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is going to talk about Neonatology part 26. It's a very beautiful class. I hope my voice is audible and visible to everyone. Let me know if my voice is audible and visible so that I can continue with the sessions. Thank you so much everyone for all the love and support. You have been very kind. Today's topic of choice is Neonatology part 16. Yes, so we have to make sure that my voice is audible and visible for everyone. Yes, hello everyone. Hi Osama, Shubhangi. Yes, is it coming? Yeah, I think it's coming. Great. Okay, let's start this class. Let's start this amazing live session. Yes, perfect. So, hello, Dr. Shubham. Yes, Metazillo, everyone, amazing people. हाँ जी, चलो शुरू करते हैं. Unacademy is one of the beautiful platform basically which gives us a beautiful thing to connect together, to be together, and to study together. Today's topic of choice is nothing but Neonatology part 16 actually, and yes, this is the previous offer. We had the 3 months extension and a 6 month extension. I hope you guys have taken that. Also in this Unacademy, our target is NEET PG 2023 with amazing 6 months batch and a 3 months module batch where we have basically high yield revision batch and the proper subject wise revision batch. Okay, so it will be nice if you have taken that. Also in the Unacademy we have this NEET PG 2023 test and discussion batch for the previous students. The duration is for 9 months. That's it. We have the plus subscription, iconic, light, MBBS Prof 1 and UPSC CMS subscription with a beautiful duration, the prices and all the amazing durations we have. Exactly. Dr. Mary says, hello sir, recently joined Unacademy. Thank you for everything. Thank you so much, Dr. Mary, and be in touch with me. My live classes as much as possible. Wherever you find me live, be in touch with me. It will be nice. Yes, today's topic of choice is Respiratory Distress Syndrome. This is the Neonatology part 26. Today's topic of choice, we're going to talk about a very beautiful topic, a simple, sober and understandable topic that is nothing but Respiratory Distress Syndrome. Good evening, Dr. Shubham, Metazillo, Shubhangi, Monimala, amazing people. Before starting any segment, we always have a motivating quote. And today's motivating quote is, two things prevents us from being happy. Two things prevents us from being happy. Number one, living in the past, and number two, observing others. So two things prevents us from being happy. Number one is living in the past. We all have lot of regrets. We all have lot of resentments and lot of things we wish we wouldn't have done, couldn't have done, must not have done. But now again, living in the past. Forget about living in the past. Think about future. Think about present, and try to do best in whatever you can do now. Okay, so stop living in the past. Stop living in the past. And also very importantly, and one more thing which prevents us from being happy is observing others. Observing others, that oh my god, he is so rich, oh my god, they have so many friends, oh my god, they have two big cars in their house, oh my god, they have a top floor penthouse in a very beautiful apartment, and that's so amazing. So everyone has their own story, everyone has their own journey, and everyone has done something known as hard work. Everyone has done hard work. There is a saying, right? The grass is always greener from other side. The grass is always greener from other side. दूसरे की जिंदगी हमेशा अपने से अच्छी लगती है, ठीक है? लेकिन वो कहते हैं ना that everything which glitters is not gold. Everything which glitters is not gold. हर चमकती हुई चीज सोना नहीं होती. हर चमकती हुई चीज सोना नहीं होती. सबने मेहनत की है. Everyone has done hard work, so we must appreciate everyone's hard work and live and let live. Great. अभी 5 स्टूडेंट लाइव थे. अभी 5 से डायरेक्टली 60 हो गए. अभी ऐसे 100 हो जाएंगे. Okay. Yeah. So Shubhangi is saying, Osama, we have one of our favorite student, Osama. He used to come to our classes, but he has some net issues there in his city, so he's not able to come and he's missing us. Yes, I spoke to Osama also, Shubhangi, and yeah, we are missing him too. Hello, Monimala, Nisar, Shubhangi, Deepak, Ritu, and so many other people. Let's start this class. Respiratory Distress Syndrome. What is that? So again, let's just talk about it. Okay, so a little bit talk about it. Respiratory Distress Syndrome. Like, number one, is this a problem of a preterm baby? or is this a problem of a term baby? That is the first question comes to my mind. Okay, let's talk about, okay, like put your good positive vibes in the class and finish it off. Okay, good evening Dr. Study, the IDs study motivation. Good evening. So yes, number one, it is the problem of a preterm. A preterm baby is having distress, okay? A preterm baby is having respiratory distress, okay? Yeah, why? Can anyone please tell me, discuss with me why a preterm is having respiratory distress? Kavya, Bajrang, क्यों एक प्रीटर्म बच्चे को क्यों ऐसा क्या हो गया? Why is he having respiratory distress? So sir, because the more the baby is preterm, the more the baby is less than 37 weeker or a preterm baby, the baby's lungs are not mature. Can I write this line? Lungs are not mature. Also at the same time, can I write something known as surfactant? Surfactant basically is a lipoprotein present in the alveoli of the lung. हमारे lungs के alveoli में, in our lungs, this is our alveoli, we have something known as surfactant. Surfactant is present in the alveoli of the lungs, which keeps the alveoli open, which keeps the alveoli patent open, right? As the baby is premature, हमें लगता है कि बच्चा जितना premature होगा, बच्चे का lungs उतना mature नहीं होगा. Baby's lungs wouldn't be have that much maturity. Why? Because of the decreased production of surfactant, and that's it. Okay, so that comes to very basic question. Surfactant, when are you expecting the surfactant in the lungs? When are you expecting the surfactant in the amniotic fluid? That is another very important PG entrance question, number 3 for the FMG students. Yes, so surfactant, there are two questions, important ones. Surfactant is present in the amniotic fluid, in the amniotic cavity. Anyone by how many weeks of life? Yes, Dr. Shubhangi is very right. By 28 weeks of life. You're expecting, yeah, exactly. So you're expecting the surfactant in the amniotic fluid by 28 weeks of life. That is the first point. Second, when are you expecting the surfactant in the lungs? Yeah, in the mature levels in the lungs? Yes, by 33 to 35 weeks. By 33 to 35 weeks, you're expecting the surfactant in the lungs, whereas you're expecting the surfactant in the amniotic fluid by 28 weeks. So can we therefore appreciate any baby who is less than 33 to 35 week a baby will definitely can have a problem, issue with the breathing because of the deficiency of surfactant. Yes, Dr. Akanksha says, are you not well, sir, today? Yeah, I have got little cough actually, that's why I'm, my voice is having this little issue. Okay, perfect. चलो खत्म आगे. ठीक है, ये बात यहाँ खत्म होती है. 28 week and 33 to 35 weeks is the take home message in this class for surfactant production in the amniotic fluid and in the lungs. What is the other name of surfactant? As everyone knows, the other name of respiratory, the other name of RDS is nothing but HMD. The other name of respiratory distress syndrome is nothing but hyaline membrane disease. The other name is hyaline membrane disease. Yeah, exactly. मुझे थोड़ी ठंड लग गई. Yeah, लोगों को लत लगती है. मुझे तो तेरी लत लग गई. और मुझे यहाँ ठंड लग गई. ठीक है? Okay, 1 second. Let me just put my laptop on charging. ऐसे नखरे करता है मेरा लैपटॉप. है वैसे एप्पल का, पर नखरे ऐसे जैसे किसी और लैपटॉप के हिसाब से. 1 second. Yes. Yeah. So let's move further. Okay, I assume charge लग जाएगा, देखते हैं. हाँ, okay, हाँ. Next important point. Yeah. So now we have to talk about it. 1 second. हाँ, एक दिन का बच्चा है. He is 30 weeks old. We have a baby who is 1 day old, who is 30 weeks old, born through normal vaginal delivery, came with distress. How do you approach this case? Hanji, can anyone answer in the comment section basically? Yes, a 30 weeker old baby distress के साथ आया है. Yes, exactly. Yeah. So how do you approach this case? Who will tell me how do you approach this case? What are the other causes? What are the other causes of distress in a newborn? The first differential diagnosis which comes to my mind obviously is hyaline membrane disease. But can we have any other differential diagnosis of distress in a baby? Anyone? Yes, very good. So most importantly, point number 1, what we understand, there are a lot of causes of distress in a newborn, right? There are many causes of distress in a newborn. Yes, exactly. So, upper airway obstruction issues, lung parenchymal issues, developmental disorder issues, and non-pulmonary causes issues. So, upper airway obstruction issues. Can you please tell me any differential diagnosis of upper airway obstruction? कुछ ऐसा कुछ कर सकते हो आपके the baby like lungs are fine, but the baby has some upper airway obstruction issue, and then the baby having distress. My question is that this baby came with distress, okay, right? One differential diagnosis, of course, is 30 weaker, right? Less than 37 weaker is a preterm. So one differential diagnosis, of course, is a hyaline membrane disease, which is also known as respiratory distress syndrome. But apart from that, can we have any other differential diagnosis? Yes. The first important differential diagnosis, can I write choanal atresia? Very, very important. Yes, Shubhangi is so right, bro. Choanal atresia. How will the patient of choanal atresia come? Can we please have a quick revision? Choanal atresia का बच्चा कैसे होता है? Yes, Dr. Mary is also right. We can also think of tracheoesophageal fistula. Let's quickly revise about it. So if this is my face, okay, yeah. So choanal atresia. So failure to pass a nasogastric tube. If I'm putting a NG tube, failure to pass a nasogastric tube, you will think of choanal atresia number one. Yes, and yeah, and Dr. Amjad is right. Choanal atresia, the distress improves on crying. Very, very $1 million line. A baby having distress which improves on crying, that happens in choanal atresia. Are you understanding? In a case of choanal atresia, number one, failure to pass a nasogastric tube. Number two, distress. बच्चा अगर चुप है, so distress increases on when the baby is quiet, and the distress and cyanosis improves on crying, because once the baby cry like wah, so he takes a breath also. Nose he can't take a breath, so mouth he takes a breath, right? So that's what. So number one, very importantly, we have choanal atresia. That is first differential diagnosis, right, of a case of baby having distress. Next come tracheoesophageal fistula. Can you please tell me exactly? Yes, so cannot pass a NG tube and a distress improves on kind, happens in choanal atresia. Now comes to tracheoesophageal fistula. Quick, that also baby can have distress, right? What are the important points of tracheoesophageal fistula? Can anyone answer in the comment section? Okay, yeah. Is my voice coming? I hope, yeah, it's coming to me. Hanji, exactly. Very true. So Dr. Mary is right. Okay, Dr. Mary, very good. So, yeah. Tracheoesophageal fistula. Tracheo. This is my windpipe. This is my food pipe, and there is a fistula. There is a connection. Fistula. This is my trachea, and this is my food pipe, right? So whenever I put a nasogastric tube, there is a coiling, right? There is a coiling of the NG tube. Very, very important point. There will be the coiling of the nasogastric tube. That is the first point. Yes, there will be a coiling of the nasogastric tube. What else? Exactly, Dr. Mary. Very good. The patient will have drooling of saliva. See, there is a blind pouch, no, in my food pipe here there might be a blind pouch. So whatever secretion, whatever sputum I have, I cannot swallow it down, right? So number one, can I write frothing of secretions? Very important. The patient will have frothing of secretions. Yes. The patient will have drooling of saliva. Yes. Failure to pass a nasogastric tube. Yes. The baby having distress. Yes, 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 yes. And the mother will be a case of oligohydramnias or polyhydramnias in a case of tracheoesophageal fistula. Dr. Shubham, bro, क्या लगता है? Doctor, yeah, we have Dr. Wafa, Amzad, Nisar, Mary, Priya, Shubham, amazing. Yes, perfect. And then Dr. Nisar is right. The classification for tracheoesophageal fistula is gross classification. Gross classification. True. Aspiration risk, undoubtedly yes. The patient will have URTI, LRTI, all those things also. Aspiration भी होगा. And the mother will be a case of polyhydramnios. When the mother is a case of polyhydramnios, means liker, means the baby is passing urine very well. The baby is passing urine very well, but is not able to swallow the urine because he is having tracheoesophageal fistula. So that's what. So now two differential diagnoses of a baby having distress are: number one, choanal atresia. Number two is tracheoesophageal fistula. So now, has everyone understood this much? Yes or no? Has everyone understood this much? Yes or no? Let me know. In the meantime, I will just check my this thing, what you called. मेरा क्यों काम नहीं कर रहा ये वाला? 1 second. क्योंकि 6% बैटरी रह गई है. अगर 6% बैटरी रह गई है तो फिर आगे प्रॉब्लम हो सकती है. 1 second. Yes, 1 second. समटाइम इट हैपन्स दैट वे, जब क्लास शुरू होती है ना तब मेरे लैपटॉप को चक्कर आता है, फिर लाइट चली जाती है, फिर मुझे मेरी खांसी बढ़ जाती है। ये दुनिया में यही दस्तूर है, ऐसे ही होता है लाइफ में। 1 सेकेंड ब्रो, आज काम क्यों नहीं कर रही है? So has everyone understood? Okay. डेवलपमेंट ऑफ टीएफ, डॉक्टर ने साथ डेवलपमेंट ऑफ टीएफ तो फिर ब्रो बाद में ही पढ़ेंगे। डेवलपमेंट ऑफ टीएफ अभी तो नहीं पढ़ सकते। डेवलपमेंट ऑफ टीएफ इज लिटिल डिफरेंट टॉपिक ब्रो, दैट्स व्हाई। ओके, yeah, 1 second. Okay, next important point. Okay, so the other important cause of distress, as we can appreciate in this picture, are very important. Yeah, so let's talk about it like this. Yeah, so we have something known as, very importantly, the other important cause of the upper air. What are we reading? Hyaline membrane disease will come, but before that we are covering the important causes of distress in a baby one by one beautifully. Other than nasal cause, come from the nares, little go down to the oral cavity. Oral cavity, if the patient has macroglossia, yes, the baby can have distress, and if the patient has microgonathia, small jaw, then also the baby can have distress. Now exactly, yes, so yes, exactly, so zindagi true. So what do you call macroglossia? Can anyone please tell me any important differential diagnosis of macroglossia? Do we know any syndrome which has macroglossia as a very important part? Exactly, yes, very true. Dr. Wafa, Mariam, Nisar, yes. So have you heard of Beckwith-Weidman syndrome? Very important. Yes, the important point of Beckwith-Weidman syndrome is really important for us to understand. In that syndrome also the patient will have a macroglossia. Yes, very good. The patient will have a macroglossia in a case of Beckwith-Weidman syndrome, right? Macroglossia, true. And microgonathia किसमें होता है? Microgonathia, important example we have is Pierre-Robin syndrome. In a case of microgonathia, we can have in a case of Pierre-Robin syndrome. Have you heard of Pierre-Robin syndrome? Difficult bag and mask ventilation, difficult intubation, Pierre-Robin syndrome. Exactly, that is one thing we need to understand. So yeah, that's important point about it. Yeah, so let's move further. So this part is over. Macroglossia and microgonathia is important, that I have told you. Yes, Beckwith-Weidman syndrome has macroglossia, and Pierre-Robin syndrome will have microgonathia. Okay, perfect. Next important point which we need to understand in this part are, yes, very important. So congenital goiter. In congenital goiter also patient can have distress basically. And then larynx, we have down cause laryngeal web, laryngeal stenosis, or any vocal cord paralysis. So these all are the important upper airway. It's a very beautiful theory MBBS question. How do you approach a distress in a newborn? Everyone knows the most commonest cause of distress in a preterm is hyaline membrane disease, but these all are important. Nasal, choanal atresia; oral cavity, macroglossia, microgonathia; neck, congenital goiter; and larynx, laryngeal web or laryngeal stenosis. Next important part, yes, next important part is this one, lung parenchymal disease. Lung issue, everyone knows lung issue. The most important ones are respiratory distress syndrome, which is our topic of choice, and transient tachypnea of newborn. If you are a newcomer, you must understand TTN is nothing but transient tachypnea of newborn. Transient tachypnea of newborn, this is what we know, the definition of TTN. In the further videos we're going to talk about TTN also. So RDS and TTN are really very important. Abhi ke liye just the name you should know, transient tachypnea of newborn. Exactly, yeah. Perfect, very well put, Dr. Shubham, very right. Yes, brother. And also the patient of meconium aspiration syndrome also can have distress, but naturally, as I told in my case, my baby was a 30-week-old, preterm. So preterm baby, naturally you don't see meconium aspiration syndrome. Meconium aspiration is more common in the ones who are post-dated baby, and even IUGR babies and babies with breech presentation, right? We have done that part. In this part we have done. The last important part is this slide, very important. After the upper airway obstruction, lung parenchymal disease, developmental disorders, very important. Developmental disorder, we have diaphragmatic hernia, pulmonary hypoplasia, and pleural effusion. Developmentally ही problem है. Diaphragmatic hernia, I hope you have done that, right? Congenital diaphragmatic hernia, can we have at least 2 points, just 2 important points of congenital diaphragmatic hernia? Yes, congenital diaphragmatic hernia, everyone knows the patient will have a scaphoid shape abdomen. The patient will have a scaphoid shape abdomen. Bowel sounds in the chest. Bowel sound in the chest, right? Scaphoid shape abdomen, bowel sound in the chest, yes. Bag and mass ventilation is contraindicated, very well put. That also very important, that's very well put. And the most commonest type of congenital diaphragmatic hernia is nothing but Bocker-Dulac hernia, posterior lateral variety, Bocker-Dulac hernia. The most commonest type of congenital diaphragmatic hernia is Bocker-Dulac hernia. So this can the baby come with distress of CDH? Obviously, when the bowel sounds are in the chest, then definitely patient will have distress. There's no doubt about it. And the non-pulmonary causes, very beautiful one. 30-weeker baby came with distress. I agree, 30-weeker baby is a preterm and lung issue can definitely happen leading to RDS. If by mistake the lung is normal, by mistake the mother has taken Dexa or betamethasone coverage, the baby lung are fine. The other important non-respiratory causes of failure are, the distress are congenital heart disease, right? Or any congenital heart disease or congestive cardiac failure. Congenital heart disease, one question I have, which is the most common congenital heart disease in cardiology? Anyone? Which is the most common congenital heart disease in full cardiology? Who will tell me? Quick answers, please. Yes, which is the most common congenital heart disease in cardiology? Ventricular septal defect is the most common congenital heart disease in cardiology, right? And which is the most common acyanotic congenital heart disease, ACHD? Yes, which is the most common acyanotic congenital heart disease in cardiology? Dr. Himanshu, Suman, Priya, Metazillo, so many people. Yes, the most common acyanotic congenital heart disease in cardiology is also VSD, and the most common congenital heart disease in full cardiovascular system is VSD, ventricular septal defect, right? Now coming to the topic per se. The topic per se, we have hyaline membrane disease, which is also known as respiratory distress syndrome. The subcategory of the topics are incidence, risk factors, etiology, and pathophysiology of this issue. Incidence, naturally everyone knows that if the baby is a term baby, rarely you will see respiratory distress syndrome. And if the baby is less than 28 weeker, there are 80% chances कि baby को distress होगा. There are 80% chances if the baby is such a pretermer, then he will have lung issue, he will have a surfactant deficiency or a surfactant problem. That is the first point. Okay. Perfect. Next important point which I can understand, yeah, risk factors. This is a good question. Can you please tell me any important risk factor? See, prematurity everyone knows, right? Prematurity everyone knows is the important risk factors for our what you call in a case of respiratory distress syndrome. Other than prematurity, can anyone please tell me, other than prematurity, what are the other causes of distress in a baby? Prematurity समझ में आता है. Can we have any other important cause of distress in a risk factor in the baby? One very important other than prematurity, we have maternal diabetes. This is so important. हाँ, किसने बताया diabetes? कौन बताया? Yeah, डॉक्टर वफा ने बताया है. Great. Exactly. Yeah. Yes, Dr. Akanksha. So I'll repeat again, hyaline membrane disease, right? Respiratory distress syndrome. So prematurity is a risk factor. The more the baby is premature, the lungs are not mature, बच्चे को हो गया RDS. Next very important is maternal diabetes. Why maternal diabetes? Because this is a question, okay? See, this is a star mark exam question, remember that, okay? If the diabetic mother, diabetes basically interfere in the production of surfactant. Always remember, diabetes interfere in the production of surfactant. Very important. डायबिटीज जो पर से होता है, ठीक है. दैट्स वाई द इन्फेंट बॉर्न टू डायबिटिक मदर, जो बच्चे डायबिटिक मदर के होते हैं उनमें भी डिस्ट्रेस देखा जाता है. इवन इन्फेंट ऑफ डायबिटिक मदर कुड बी वन इंपॉर्टेंट इंडिकेशन ऑफ गिविंग surfactant also. Are you understanding? See, important indication of giving surfactant is of course hyaline membrane disease or respiratory distress syndrome because of surfactant deficiency and all that. Indirectly the two other important indications of giving surfactant are, number one, maternal diabetes, or I would say infant of diabetic mother, because diabetic mother interferes in the baby's the surfactant production of the lungs. Okay, and also one very important thing, meconium aspiration syndrome. Remember in the evening class we did meconium aspiration syndrome, right? What were the X-ray findings of meconium aspiration syndrome? Can anyone tell me? Dr. Shubham, meconium, बच्चे ने सारा meconium ले लिया है, the baby has taken full meconium inside. So how will the baby present? Will the baby have distress? X-ray what will you see? Will you see hyperinflated chest? Yes or no? Meconium भर गया ना अंदर, so you'll have a hyperinflated chest. And also very important, heterogeneous opacities. You remember heterogeneous opacities? I told you one is homogeneous opacities, one is heterogeneous opacities. And very important, how do you look, what is this homogeneous opacity? This one, like, can you see that this one? Can you see this white like a full, like a white patch only? I'll show you a better picture also. This one, can we appreciate this one? What is this? Is this a homogeneous or a heterogeneous? This is a homogeneous opacity. White out lung, white out, बिल्कुल चपटा हुआ, एकदम सफेद, homogeneous opacities. And what was happening in a case of अपना Meconium aspiration syndrome? It was heterogeneous opacity. Okay, heterogeneous opacity. Okay, that's what. So the important risk factors for what you called this one are what you called in a case of hyaline membrane disease. Number one, we have of course is prematurity. Number two, I have told you regarding the maternal infant of diabetic mother. Then also we have genetic factors like history of respiratory distress in the family. Number one. Number two, also important ones we have is last one second. Even congenital diaphragmatic hernia also. Even a congenital diaphragmatic hernia also interferes naturally, no? Because all the intestine are in the chest, no? The intestine have come to the chest, right? So that's what compressing the lung, causing some lung issue. So then also that they can have surfactant issues also. And then we have genetic disorders. Surfactant, this is SPB and SPC. What is this SP? Surfactant protein B, surfactant protein C, ऐसे करके genetic factors होते हैं. Okay, genetic factors, right? Okay, great. I hope everyone is understanding. Please put a like button. Did you understand this much? We understood the various causes of distress in a baby, the various risk factors, incidents. These all amazing stuff we have understood. Dr. Grace, great, very good. We have new students like Manjunath, Grace. Yes, exactly. Yeah. ओके हाँ, डॉक्टर हिमांशु कहाँ लिखा है, इसमें कहाँ लिखा है ब्रो, जरा पढ़ के बताइए. मैंने कहाँ लिखा है कि मैटरनल हाइपरटेंशन डिक्रीजेस द रिस्क, कहाँ लिखा है हिमांशु? मुझे किताब का फोटो भेज मुझे, तब मैं देख के बताऊंगा तेरे को, ठीक है. अच्छा, नाउ वेरी इंपॉर्टेंटली इन द सर्फेक्टेंट व्हाट इज द कंस्टिट्यूएंट, दिस इज द वेरी इंपॉर्टेंट क्वेश्चन, व्हाट इज द कंस्टिट्यूएंट ऑफ सर्फेक्टेंट. सर्फेक्टेंट बनता किससे है? ओके, मोस्ट इंपॉर्टेंट वी हैव 68%. सर्फेक्टेंट बेसिकली 68% of surfactant composition is because of lecithin. Okay, lecithin. You need to know the various composition of surfactant. One of the important composition is lecithin, and we have something known as LS ratio. That's an exam question, the star mark PG question, FMG question. Whenever, yes, exactly. So whenever the baby has LS ratio more than 2, normally if a baby has LS ratio, what is LS? LS is lecithin sphingomyelin ratio. Lecithin/sphingomyelin ratio. Lecithin is to sphingomyelin ratio. If it is more than 2, then what will you say? It is a mature lung. Okay, remember that. If the LS ratio, exactly, if the LS ratio is what you called more than 2, then I will say this is a mature lung. This is okay, remember that. So the various compositions of surfactant are these all. We have lecithin, which is nothing but dipalmitoyl phosphatidylcholine. Then we have phosphatidylglycerol, phosphatidylethanolamine, and phosphatidylinositol. So just in general you should know, yeah, very importantly, yes. So I'll repeat again, what is the most important composition of surfactant? The answer for this question will be dipalmitoyl phosphatidylcholine, which is nothing but lecithin. How do you assess the lung maturity of the lung, or how do you assess the lung maturity? Basically, sir, हम LS ratio करवाते हैं एक baby का, we get the LS ratio done. If the LS ratio is more than 2, what will you do? If the LS ratio is more than 2, then I'll say this is a mature lung. The other components are L is nothing but lecithin, the other name is dipalmitoyl phosphatidylcholine, then phosphatidylglycerol, ethanolamine, inositol, then we have surfactant protein A, B, C, D. Okay, has everyone understood this much? Okay, we have okay, great. So we have an ID, the name is a star, and they say that, sir, you are so cute, dil hi aa gaya. If you were not my teacher in MBBS, I would have never missed even a single lecture. Like, if you were my teacher in MBBS, I would have never missed a single lecture. That's very sweet of you, Dr. Star. That's very beautiful. That's very kind of you. Be in touch and let's make the journey more beautiful, right? So can we please answer this question? Lungs do not collapse during ड्यूरिंग एक्सपीरेशन बिकॉज ऑफ द प्रेजेंस ऑफ डैश। या ऐसा क्या होता है लंग्स में कि वो कोलैप्स नहीं होते क्योंकि एक चीज की मौजूदगी होती है। लंग्स डू नॉट कोलैप्स ड्यूरिंग एक्सपीरेशन बिकॉज ऑफ द प्रेजेंस ऑफ, यस, वी हैव लेसिथिन व्हिच इज नथिंग बट डाइपalmityl phosphatidylcholine is what the answer. Okay, yeah, great. हाँ, इट्स अ ट्रैप कहाँ, इट्स द क्वेश्चन है ब्रो। हाँ ठीक है, आकांक्षा समझ में आ गया। ओके, वेरी गुड। ओके ठीक है, डॉक्टर अस्टार मेटाजिल्लो, या सो दिस इज व्हाट इंपॉर्टेंट यू मस्ट नो, लंग्स डू नॉट कोलैप्स ड्यूरिंग एक्सपीरेशन बिकॉज ऑफ द प्रेजेंस ऑफ लेसिथिन। अगर लेसिथिन नहीं होता तो लंग्स कोलैप्स हो जाते हैं। नेक्स्ट इंपॉर्टेंट पॉइंट वी नीड टू, हाँ दिस इज अगेन वेरी इंपॉर्टेंट, नाउ सिंथेसिस एंड स्टोरेज ऑफ सर्फेक्टेंट। यस डॉक्टर निसार, वेरी गुड, ठीक है। डॉक्टर ए स्टार सेज इतनी क्यूटनेस कहाँ से आती है? एक्चुअली आई ड्रिंक मिल्क, आई ड्रिंक 1 glass ऑफ मिल्क, आई टेक 10 almonds एंड 1 spoon ऑफ हनी, सो इसलिए वहां से सारी क्यूटनेस वहीं से आ रही है मुझे लगता है, ठीक है। द सिंथेसिस एंड स्टोरेज ऑफ सर्फेक्टेंट, बेसिकली सर्फेक्टेंट, राइट, सर्फेक्टेंट कहाँ बनता है? वेयर इट इज फॉर्म? इट इज फॉर्म इन द लंग्स, राइट, इन द लंग्स ऑल्सो वी हैव 2 type of alveolar cells, type 1 and type 2. So we have type 2 alveolar cells. Star mark, this was the FMG question. Surfactant is formed by which type of alveolar cells, type 1 or type 2? The answer is lungs में type 2 alveolar cells होते हैं, surfactant वहाँ से बनता है, that's what you should know. Okay, next important point which I must understand naturally, one second, yeah, so surfactant why करता क्या? Surfactant basically it prevents in collapsing of the lung naturally. If this is my alveoli and here we have the surfactant, over here we have the surfactant, basically क्या करता है? It prevents the collapsing of the alveoli, it prevents the collapsing of the alveoli, so basically in a simple Hindi language it keeps the alveoli open, that's what you should know. Okay, perfect, yes, exactly. Yeah, and also at the same time it helps in maintaining the FRC. Now Dr. Shubham, could you please tell me, Dr. Shubhangi, what is FRC? FRC का मतलब क्या होता है and what is the total FRC? Anyone? Yes, Dr. Priya. Yeah, मुझे लगा pediatrician हो कि बच्चे का प्यार मिलता रहेगा, ऐसा होगा। yeah, that's also one way, my dear, that's very well right you're saying. Manish, Supernova, Himanshu, Study and a Star and our Shubham. What is FRC? Exactly, FRC is nothing but very importantly, yeah, that's very well put, functional residual capacity. I'll repeat again, what we called functional residual capacity. So I'll repeat again, what are we studying? We are studying surfactant. What is surfactant? Surfactant is present in the alveoli of the lung. ओके, व्हाट इज द फंक्शन ऑफ सर्फेक्टेंट? सर्फेक्टेंट हमारे एल्वेलाई को खुला रखने में मदद करता है। सर्फेक्टेंट हेल्प्स इन कीपिंग द एल्वेलाई ओपन। ओके, सर्फेक्टेंट बनता कहाँ पे है? वेयर इट इज फॉर्म? इट इज फॉर्म इन द लंग्स बाय द टाइप 2 alveolar cells in the lungs. Okay, what else? What is the other function do? Basically surfactant, no, it maintains the FRC of the lung. It maintains the FRC of the lung. What is FRC? FRC is equal to functional residual capacity. FRC is equal to ERV plus RV. Remember, FRC is equal to ERV plus RV. What is ERV and what is RV? ERV is expiratory reserve volume and RV is the residual volume. I hope we have done that. You have done that in your respiratory classes. Yes, see, so beautifully Dr. A Star is answering what is FRC. Exactly. So yeah, I'm going to show you one graph, one second. Yeah, this is a very beautiful graph, guys. So can we see, this is the tidal volume. Like normal I'm taking breath, no? This is tidal volume, right? Now we have inspiratory reserve volume. What is this inspiratory reserve volume? If I'm taking normal breath, so this is the inspiratory reserve volume. And then what is this one? So this one is the expiratory reserve volume. We have inspiratory reserve volume. Yeah. Forceful inspiration is the inspiratory reserve volume, and forceful expiration is the expiratory reserve volume. Okay, and still there is some air left. Still after my forced expiration, there is still some air left, and that is known as residual volume. That is known as residual volume. So can we please remember, this is nothing but ERV, expiratory reserve volume, and this is nothing but RV, residual reserve volume, residual volume. So FRC is equal to ERV plus RV. Functional residual capacity is equal to expiratory reserve volume plus residual volume. FRC is equal to ERV plus RV. That is very important. And then पूरे को मिला के हमारा होता है total lung capacity. And yeah, in normal, in our babies, ERV is 1200 ml, RV is equal to 1200 ml. Total is 2400 ml. FRC of the lung is 2400 ml होता है, ERV plus RV. ERV is 1200 and RV is 1200. Yes, Dr. A star is very right. Residual volume is very necessary. Done. Has everyone understood this much? Yes or yes? इतना समझ में आया? Because 40 minutes is already over. We have 5 more minutes, then the class is already over. समझ में आया या नहीं आया? या मेरे बाइसेप्स दिखाऊं मैं? बाइसेप्स. कल जिम नहीं गया मैं, कल ड्यूटी थी, कल नाइट ड्यूटी थी मेरी, आज भी जिम नहीं गया मैं. ठीक है, perfect, crystal clear. चलो, बहुत अच्छी बात है, beautiful answer. Okay, great. And also and this part we have already done, bro. पेन कहाँ गया मेरा? एक सेकेंड, पेन कहाँ गया? तू न जा मेरे बादशाह, एक वादे के लिए. ओके, मैं अपने उसकी बैटरी देख लूँ यार एक बार में ना, मैं बैटरी हटा के कर रहा हूँ. वी हैव ओनली 2% बैटरी इन माई लैपटॉप. 1 सेकेंड, बिफोर वी ऑल डाई आई मस्ट चार्ज माई लैपटॉप. 1 सेकेंड, 1 2 and 3. आज ऐसी 1%, only 1% battery left. Exactly. Who's the baby in your DP? That baby was my first patient. Actually. So that's what that baby, मेरा MD first year में मेरा पहला जो बच्चा मैंने treat किया था, that is the baby. उसी की ही सारी booklets और किताबें मैंने बनाई हैं. ठीक है. Okay, so can you please answer this one? Surfactant appears in the amniotic fluid by how many weeks? Who will tell me? A, B, C, D? Exactly. Yes. Okay, Dr. Nisar, कोई बात नहीं, पूछ ही रहा है गुड्डू, बोस क्या हो गया? Okay, so the best answer for this one is nothing but, as everyone knows, surfactant appears in the amniotic fluid by 28 weeks. Surfactant appears in the amniotic fluid by 28 weeks is the best answer. This part is done. Okay, great. This part is over. Okay, let's go to the other one. Clinical features. हाँ जी, एक बच्चा, अब now we are discussing respiratory distress syndrome, right? And now we are discussing proper like hyaline membrane disease or respiratory distress syndrome, right? So 5 more minutes and this class is over now. Exactly. Yes, exactly. मनीष, हाँ जी, मनीष कह रहा है आपने रिप्लाई नहीं किया. मुझे अभी मैसेज कर, मैं करता हूँ रिप्लाई. सॉरी यार, मैंने देखा नहीं होगा, मेरे ना बहुत सारे चैट्स नीचे जाते हैं इसलिए मैं देख नहीं पाता. मुझे अभी मैसेज कर, मैं मोबाइल का मेरा पूरा अभी देखो रिप्लाई करता हूँ. Clinical features. What are the clinical features the baby can have of this one, what do you call them, hyaline membrane disease? Most importantly, yes. Now this is a very important slide. Have you heard about Silverman Anderson score and Downey score? Yes or no? We have done that, right? If a baby is having distress, if a newborn baby is having distress, so there is for the assessment of severity of distress, in a preterm, we use a scoring known as Silverman Anderson score. Silverman Anderson score is the name of the scoring system for the assessment of severity of distress in a preterm. And in the term baby, this one, very beautiful. In a term baby, you can appreciate, we have something known as Downey's score. This one, we have something known as Downey's score. For the assessment of severity of distress in a preterm, we use very important, Silverman Anderson score. For the assessment of severity of distress, we use something known as Downey's score. Yes, Dr. Akanksha wants to ask something. Yes, my dear Dr. Akanksha, please tell me. Hanji, everyone knows about it. Exactly, very well put. So the important points as we have done, we have something known as very importantly, upper chest retractions, lower chest retractions, xiphoid retractions. This part will be nasal flaring. इसको यहाँ काट देते हैं. So this one is nasal flaring, and then the baby will have grunt. The baby is having grunt, right? So upper chest retractions, lower chest retractions, xiphoid retractions, nasal flaring, and grunt. These are the 5 important points we have done multiple times in our classes. Yes or no? Exactly. And then we have Downey's score. Some book says modified Downey, some book says Downey. In the Silverman, we had upper chest, lower chest, and xiphoid retractions, right? Now in Downey's, there is only one word, that is the what do you call it, retraction. That is the first thing. Only one word is there, that is the retractions. Okay, then वहाँ पे क्या था, very importantly, grunting was there also, grunting is here also. Two things are common, okay, in the Silverman-Anderson score and Downey score. 5 points are there in Silverman-Anderson, 5 points are there in Downey's one. Okay, 5 points in the Silverman are upper chest retractions, lower chest retractions, xiphoid retractions. In the Downey it is just retractions. Then again, grunting is there also, grunting is here also, and same, it is 0 1 2. Here also it is 0 and it is what you called 1, and then we have 2, and there also it is 0 1 2. 0 as in normal, retractions, no retractions, and 1 is mild retractions and 2 is moderate to severe retraction. Whereas grunting, no grunting. Then 1 is grunting audible with stethoscope and grunting audible without stethoscope. This is what in general we need to know. Yes, exactly. Very good, very good. Dr. A star is very right. Cyanosis is bluish appearance of tissues, happens due to lack of oxygen. Very, very, very good. Yes, doctor, perfect answer. Dr. Suman, that's very good here. So again, can we please revise this point? 5 points are there in the Silverman-Anderson and 5 points are there in the Downeys, right? So I have I'm going to tell you a little bit more, then we have an MCQ and then we will finish this class. Okay, yeah, 1 second. 5 4 1 second. तारी लगा रहा हूँ मैं इधर. Yes, okay, let's move further. 1 second. Yeah, so I have one point, remember. Okay, so upper chest retractions, lower chest retractions, xiphoid retractions, यहाँ आएगा nasal flaring and grunt, and that also is grade 0, grade 1 and grade 2. Grade 2 is very bad. Okay, grade 2 is very bad. But one thing we need to understand over here is this one, that score more, how much score will say the patient is going into failure. If the score is more than 6, if the score is more than 6, the patient is going into impending failure. Very, very important. If the score is more than 6, the patient is going into impending failure. Well, a patient failure में जा रहा है. Yes, Dr. Osad, very sweet. Yes, very good. Very, very right you are. Okay, that you should know. And that's it. Retractions, then grunting, 1 was air entry, and cyanosis and respiratory rate. Okay, 0 is nothing, 1 is mild, and 2 is moderate to severe. Okay, so now importantly, let's do this one also, diagnosis. Yes, so how do you diagnose a case of HMD? Anyone? How do you diagnose? Bachcha aa gaya, I understood it's a preterm baby. Dr. Shubham bro, what do you think? I know it's a preterm baby, I know it is, the baby is having distress. Okay, how do you diagnose? Can we diagnose through X-ray? Obviously, by the clinical course, by the X-ray and by ABG. 3 important places are there where we can diagnose the baby: by clinical course, by X-ray and by ABG. And what X-ray? X-ray में क्या मिलेगा? Now this is very important, again a very important point. Hanji, Dr. Shubham, what is the X-ray finding of HMD baby? Everyone knows about it, right? White out lung. Exactly. Yes, exactly. White out lung is something which we'll see, right? Exactly. Perfect. Yes, so now in the X-ray in general, one thing remember which comes in exam is this one, this X-ray. What happens usually, no? So this, can you see this bronchial tree kind of a thing? X-ray में दिख रहा है आपको? See, number one, can we appreciate the lung? The black lungs are not that good, right? The blackishness of the lungs is not that great, no? So that's kind of a white out lung. And one very, very important thing we need to remember here is air bronchogram. You will see a air bronchogram, yes, or a ground glass appearance or a white out lung. Yes, that's very well put. So air bronchogram is something you will see in the X-ray. That's right. और ये इसको ही बोलते हैं, ये, can we see that this matchstick, this ये जो ऐसा वाला है, this one like that. So this is air bronchogram. The definition of air bronchogram is it is a tubular outline of an airway visible by filling the surrounding alveoli by fluid. See, are you understanding? These are the airway, air tubules, but outside क्या है इसके आसपास? All fluid, everything is filled by the fluid or inflammatory exudates, right? Because it is a premature baby, there are no surfactant, nothing, so it's all only fluid outside. So just a tubular airway, like a airway visible, and bahar kya hai? Fluid. So that is known as air bronchogram. And one very important point, this is also known as reticulogranular pattern. See, once you solve the MCQs, and there only they are asking this one. Okay, reticulogranular pattern. Where do you see? HMD. Ground glass appearance, where do you see? HMD. White out lung, where do you see? HMD. Very, very important. Okay, last question. Then this class is over. What is this? This is the last question. Then I'm gonna continue tomorrow. Hanji, what is this? Ye kya hai? Can anyone see this white, this whole thing? What is this? This is the last question of this class. Then tomorrow we're gonna continue HMT. Hanji, anyone? Dr. Shubham, ये क्या है bro? ये क्या चीज़ है? ये वाला. Can anyone answer in the comment section? What is this? Okay, fluids. Okay, collapse. Okay. ये दिख रहा है, पाइप दिख रही है, कौन है ये? बेस्ट, एनीवन हैज द बेस्ट आंसर? नहीं, एचएमडी तो लंग हो गया ना, ये एक्सरे विल बी अ केस ऑफ एचएमडी. कैन यू सी व्हाट इज दिस वन? कैन यू सी दिस वाइट? एग्जैक्टली. डॉक्टर वफा हुसैन एंड डॉक्टर रितु सतना इज राइट. ये तो बच्चा इंट्यूबेटेड है. दिस इज अ एंडोट्रेकियल ट्यूब, ईटी ट्यूब है ये, एंडोट्रेकियल ट्यूब है ये. As the baby, can you see that this whole pipe is a proper one? Okay, yeah, as this baby is kind of premature, not able to breathe, on white out lung and all that, ये endotracheal tube है. This is the ET tube. That's it. So the take home message is that in a case of what you called this one, in a case of HMD, number one, you will see a white out lung. This is one thing I understood, white out lung. One thing I also understood, ये चीज है, ये वाला, this is a air bronchogram. This is a air bronchogram or a reticulogranular pattern, and that's what you see, right? That's it. That finishes the first half. That finishes the first half of this class. Has everyone understood this much? Yes or yes, yes. क्योंकि उसके आगे और भी है. I'm going to show you another X-rays, then we'll do all the MCQs also that cannot be covered in one segment. So has everyone understood this much? Yes or no? Please let me know. Perfect, very good. ठीक है, हाँ जी, that's true. ठीक है, perfect. Dr. Ritu, Swaraj, Shubham, Shubhangi, chalo, very good. Okay, and before leaving, we always have a motivating quote, and let's have a quick motivating. We have a lot of things to cover. Okay, yeah. So we have a motivating quote in between. And what is this motivating quote? Yes. So motivating quote is that only, as I told you in the previously. Also, number one, like, be amazing. Okay, be amazing. Just live life. And we always say, all you dream, whatever you dream is on the other side of your fear. Whatever you dream is on the other side of your fear. Okay, don't, you are like, just tell yourself that you can do anything in life. Okay, you can do anything in life. Everything is possible if you do it properly. If you put your heart and soul, everything is possible. You can go to moon. That's possible. You can join swimming classes. That's possible. Everything is possible. All you have to do is just believe that you can do it. Okay. And all you dream is on the other side of your fear. Okay, other side of your fear. So don't get scared. Everything is fine, and you will get it. Okay. Yes, exactly. Okay, we have Dr. Ansh Arora has this one. My name is Ansh Arora. I am a pre-medical student, and my father is okay. But I need to join MBBS. Do something. Can you please? Okay, Dr. Ansh Arora, right now the Unacademy, all the lectures of mine are totally free. If you open this YouTube channel of Unacademy, there are some 40, 50, 60 videos of mine. They are totally free. If you join the Unacademy page also, my videos right now, they are totally free. At least start watching those videos and start making notes. That way I think that this is the first thing we can help each other, right? Okay, great. My voice is getting equate. Chalo, then I'll go then. Take care. Be happy, everything is fine. We're gonna sign out. See you tomorrow at 5:15 p.m. Bye.